anatomy of eyelids. Okay, so as it sounds, I have to talk about the eyelid. So there are multiple layers, obviously. The first one is skin. It is the thinnest skin in the body. Next comes, then after skin we have what? I have subcutaneous. Under the skin I have a areolar tissue, okay, with no fat is here, okay. Then I have a muscle layer, okay. In this muscle layer, uh, what we have, I have levator, I have a orbicularis muscle and levator palpebrae superioris muscle, okay. Under this as well we have another areolar tissue, areolar tissue. After that we have another muscle layer, and at the end we have the conjunctiva. At the end I have the conjunctiva. Now let's talk about a little bit more details. So the muscle layer, the first one that we can control is the striated muscle, orbicularis and levator palpebrae superioris. Both are striated muscles, whereas the last layer is non-striated muscle, so we cannot just control it. So what is the muscle name? The name is muscle of Muller, palpebral muscle of Muller, muscle of Muller. Two dots on U, okay. Now after that what we have here is under skin, so it is subcutaneous, and under muscle, so it is submuscular. In this areolar tissue layer, we give anesthesia, but there is still one layer missing. That is a fibrous layer that contains the fascia. So in between them we have a fibrous layer with palpebral fascia and central tarsal plate. Central tarsal plate and fascia, palpebral fascia, okay. These are the layers, and this is the in small points. Let's draw the picture now. So the first one we have is the skin, okay. So this is the skin as the picture is in the book. Using a pencil would have been better because I have to erase some part to make the sweat gland and everything. So this is the skin layer, right? This is the skin, thinnest skin. Behind that I have the sweat glands as well here. Okay, next is make the skin like at the end, make it like this for the eyelashes. So here I have some bigger one. These are the eyelash. and behind that I have the Zeiss gland. I will talk about them. Next is the subareolar tissue. So behind this I have the subareolar tissue. No need to classify them right now. There is no fat in that subareolar tissue. Next is, just take it like this, this, this. Ultimately I have to make this picture. This is my outline. So this is subareolar tissue layer. Next, after that I have orbicularis muscles. Orbicularis muscle layer will come like this, 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 this. Okay, so this is orbicularis muscle. We'll talk about it in little bit more details. Just write it here. Just write it here. Orbicularis muscle is attached to 3 points, form an oval sheet across the eyelid. It closes the eyelid, and it is supplied by zygomatic branch of facial nerve. Zygomatic branch of facial nerve. Okay. Next is levator striated muscle, another, that is levator palpebrae superioris muscle, where it is formed. This is levator muscle that is coming like this, coming like this, and here I have another gland, that is meibomian gland. Just make it like there. As the picture is inside. This is a meibomian gland. So the levator muscle comes like this. Okay. So this is the levator muscle. It opens. This is the levator palpebrae superioris. It does what? It opens. Obviously, it contracts. It opens the eyelid. Connected by oculomotor nerve, attached to 3 points that are written, but I don't think that is very much necessary, or I can remember it. Okay. Next is subareolar tissue. It contains the nerves and vessels, and anesthesia is given in here. Here is a fatty layer is here. It is full of fat. Okay. Anesthesia is given here, subareolar tissue, and my blood, artery and nerve is here. Artery and nerve is here. Next is fibrous layer that forms the fascia. So CTP. Next is fibrous layer, that is central tarsal plate. Just where to write it. central tarsal plate and fascia, palpebral fascia is there. Next is the non-strident muscle, that means the uncontrollable muscle. Alexa. Next is the Muller's muscle, that is the uncontrollable muscle, comes more or less like this. It is uncontrollable, so making a different color here. Okay, it is the muscle of Muller or Muller's muscle. In the upper lid, it actually originates from the levator palpebral muscle. Okay, it is actually originating from this, and extend in the inferior rectus muscle attached to the outer edge of the tarsal plate. It is supplied by the sympathetic nerve fibers. Okay, let's talk about some glands that are present in here. So the first one is obviously the sweat gland. So I have the sweat gland. If I write about the glands, then I have the sweat gland, and then obviously the this one, that is Meibomian gland. This is sweat gland. Next is above it the gland of Wolfram. So here in between these nerves I have muscles, I have Wolfram gland of Wolfram. Then here this is the eyelashes, and in between them I have the Zeiss gland here. So eyelash and Zeiss gland. This is the opening of Meibomian gland, sweat gland. So I have total 4 glands that are, one is remaining, gland of mole. Modified sweat gland is mole's gland or gland of mole. Okay, so I have total 4: Wolfram, Meibomian, mole, and Zeiss gland. In this particular picture, there is another gland, that is cross gland, in here, but it is not written in here. I have the cross gland. Gland of cross. Okay, next let's talk about the blood supply and nerve supply. So the blood comes from arteries of the legs from the marginal arterial arcade. Let's talk about the blood supply. So if it is the blood supply that is around the margin and in between the muscle, orbicularis muscle and Meibomian gland, so here it is known as marginal arterial arcade, and in superior eyelid there is another arcade, that is superior arterial arcade. The venous structures are arranged in 2 plexus. This is the arteries, then veins in 2 plexus tarsal and post tarsal. Same the lymph nodes as well. Then this goes to ophthalmic veins. Same goes to lymph nodes. We have pre and post tarsal, pre and post tarsal lymph nodes. Okay. Next comes the nerve supply. So the nerve supply is, we have one sensory and motor. So the sensory nerve supply is supplied by the branches of trigeminal nerve. So at first I have the trigeminal nerve, that is 5 trigeminal nerve branches, and then comes the motor. We have the facial branches, facial nerve branches, and now the branches are like here. The orbicularis and oculomotor. Facial nerve supplies to orbicularis, oculomotor supplies to the LPS, and sympathetic nerve supplies to Muller's muscle. So this is the entire anatomy of eyelids. There is one another question, that is the glands of eyelids.